GUAM Memorial Hospital suffered an operating loss of $21 million during the 2010 fiscal year. It's just one of the bleak findings from an audit released today by the Office of Public Accountability. Findings which also reveal that GMH ended the fiscal year with a $12.4 million decrease in net assets, a 215% decline from the previous year. And despite efforts to boost revenues, collection efforts fell 8%, falling from 65% recovery rate to just 57%, contributing to the $8.9 million decline in operating revenues. Bottom line, during the last fiscal year, GUAM Memorial Hospital continued to spend far more than it took in. GMH is collecting only 24 cents for every dollar owed by its patients. GMH spokesman Connor Murphy.
We're billing more than last year, but we're actually collecting less than last year. So that's really the root of what's happening here. The lack of supplies, the ability to only make net payroll, those are symptoms of the problem. They're not the actual problem. What we really have to look at is the whole system of how we pay for healthcare on this island.
Operating expenses at GMH grew 33% during the fiscal year, from $79.3 million to $105.8 million. Most of that was due to higher costs for nursing. GMH administrators told the auditors that the increase in nursing costs can be directly attributed to the recruitment of new nurses as part of GMH's efforts to pursue and win accreditation last year, which required a higher number of nurses per patient.
There's just more people who are uninsured, unemployed, and unable to pay their hospital bills, and that's really where we get hit here at the hospital, because we have no, we have to treat everyone who comes through our doors who needs treatment. We have no choice. So as more of those people can't pay their bills, the hospital gets stuck holding the bag, basically.
The audit also cited the hospital for 3 material weaknesses: collections. More must be done to collect from patients who owe the hospital money. Pharmaceutical inventory. GMH must implement a perpetual pharmaceutical inventory. Only a 1-year count is performed now. And they questioned a sole source procurement, which was used for professional healthcare services that resulted in $700,000 in questioned costs. Although the OPA applauded GMH for achieving its accreditation last year for the first time in 26 years, they also concluded that operations at GMH continue to be challenged by the hospital's high dependency on appropriations from GovGuam.
Well, we have to really take a look at how we pay for healthcare in this community. The hospital has the mandate to treat every patient who needs treatment, regardless of their ability to pay. That mandate needs to be funded. If we want the hospital to continue doing that, then we have to give the hospital the funding to do that.
Kevin Kerrigan, PNC News.